You know what I'm doing? I'm giving a breath sample, which is something that we may be doing in the future, and probably not too distant the future, to detect whether or not we are infected with COVID-19. And that would be a lot more pleasant than sticking something up the nose until it feels like it's coming out the top of your head. Well, this isn't as far-fetched as it may sound. Let's remember that our breath can be a giveaway of disease. We know, for example, that in diabetes, when insulin isn't working properly, when there isn't enough of it, and instead of using glucose as a source of energy, the body has to resort to burning fats, acetone is produced in the breath. That, of course, is the familiar odor of nail polish, and it can be detected just by the human nose. There are other conditions, for example, in liver disease. There's an excess production of the malodorous compound dimethyl disulfide, also of methyl mercaptan, which is very smelly, and this is due to the improper metabolism of methionine, an amino acid in the body. So there certainly is precedence for detecting substances in the breath, and our human breath contains about 250 compounds, probably more, the identity and the concentrations of which are determined by the chemical activity that goes on in our body. So it certainly is reasonable that when we are infected with a virus, that is going to have some changes in our body chemistry. And it may indeed show up in the virtue of compounds that are present in the breath. And these can be analyzed for. We already have some preliminary interesting evidence. For example, a study in hospitals has shown that patients infected with COVID-19 will exhale more ethyl butanoate than patients who have other kinds of respiratory infections. Ethyl butanoate happens to be the aroma of pineapples, interestingly enough. We also know that people who have other kinds of respiratory infections will, for example, exhale more butyraldehyde. So there are these interesting signatures that are present in the breath. Indeed, in Singapore, they are already using this. Anyone entering Singapore has to give a breath sample, which is then introduced into a mass spectrometer, and that instrument looks for specific compounds. Now, they haven't published any data on this yet, so hard to know just how reliable this is. In Finland, they're using dogs to sniff out COVID-19. And that has some potential. We know, for example, that dogs can be trained to sniff out certain kinds of cancer. And we're all familiar with going to the airport and having our hands swabbed and the swab be inserted into a machine that then will detect residues of explosives or illegal drugs. This is an ion mobility spectrometer that vaporizes the sample and has the ability to detect what is in it. So it is quite possible that in the future, this technology will be adapted to testing for COVID-19. And that, of course, would be a great selling item because people do not like to be, tortured up the nose. So indeed, it is possible, it may be possible in the future that when we want to have a test for COVID-19, that's all that we will have to do. However, I underline the may be possible because so far it's intriguing, but we don't yet have enough evidence. And that, for today, is our cup of joe.